Hi, welcome. My name is Jade Ratterman. I am a second year master's student at Missouri State University, and I'm going to be chatting today with you about the connection between depressive symptoms and marijuana use in adolescence. Adolescence is a huge time for brain development, and one of the major things that's happening in an adolescent's brain at this time is synaptic pruning. And synaptic pruning is where the brain goes through and eliminates the weaker neuroconnections in the brain to make way for new, stronger connections that will last for a lifetime. So, as these stronger pathways are growing, they're also more direct, and the dopamine circuits increase in efficiency as well. So, this increases the impact of dopamine on the adolescent's brain. And during adolescence, you have the most dopamine sensitivity that you will ever have in your life. This means that more rewarding, more motivating experiences that are driven by dopamine create stronger neural connections. And these stronger connections result in a greater risk taking mentality, and they're really seeking novelty, and they're very vulnerable to possible negative outcomes because their brain is focusing on the positive and not looking at the long term negative effects. With depression being so evident in our culture today, it's important to look at depression specifically in relation to adolescent brain development. So, adolescents with depressive symptoms show reduced white matter volume in the frontal and perinatal brain regions. These are the regions that are tied to emotional regulation, decision making, body awareness, spatial awareness, and impulse control, just to name a few. And specifically looking at hindered decision making and impulse control, this impacts their already hindered ability to look at risk taking as potentially negative. And so it actually increases their likelihood to take risks and gain dopamine. And we talked about dopamine a little bit earlier, but dopamine is that feel good hormone that curbs depressive symptoms and is highly sought out by adolescents because of their increased sensitivity due to synaptic pruning. To gain dopamine, adolescents engage in behaviors that enact the body's dopamine circuits. And these include things like winning a sport event, jumping off the high dive, or doing something that you love. And those are some of the positive behaviors that adolescents can engage in to gain access to their dopamine circuits. And any unexpected reward releases extra dopamine and increases that individual's desire to explore and take risks, whether they're good or bad. And because depressed adolescents have decreased decision making and impulse control capacities, their desire for dopamine release and relief is heightened, and their risk of doing risk behaviors that are negative are greatly increased. These behaviors can be detrimental decisions for their health and well being. One of the negative risk behaviors that a child could take on is the use of substances and experimenting with those. Cannabis, marijuana, and alcohol are the two most common substances in America, according to a 2018 survey. A study by Swendenson and Associates found that 78.2% of US adolescents in 2012 consumed alcohol, and 41% had reached regular drinking levels, which is 12 or more drinks per year. In 2014, studies found that 22.9% of high school seniors reported marijuana consumption in the past month, according to Windward and Associates in a survey. And the numbers for marijuana are on a rise. So in 2022, a study found that 30.7% of high school seniors reported year to date marijuana use, according to the Center for Disease Control. It's important to note that substance use is linked to additional risk behaviors like sexual activity, and it's also connected to psychiatric symptoms and disorders. According to the U.S. Office of Justice Programs, self-medicating is when an individual begins to use drugs to relieve unpleasant physical or psychological symptoms, such as depression. This source goes on to state that marijuana has become a very common self-medicating option for adolescents to use for coping. They state that in a survey, depressed teens are 2 times more likely to become dependent on or abuse marijuana than their non depressed peers. Despite the short term relief of symptoms, self medicating can have detrimental impacts on health and brain function. Becoming addicted or dependent on marijuana comes with a whole host of negative factors for the developing human mind and body. It's also important to note that because dopamine receptors are more sensitive in adolescents, that when someone tries to self-medicate as they get older, they're never going to have those euphoric impacts that they had before. So their tolerance increases as their dopamine sensitivity is decreasing. This can lead to an individual trying to take more of a substance to reach those euphoric goals when it's not possible to reach them as high as they did in adolescence. Marijuana's active ingredient, THC, primarily impacts the body's endocannabinoid system, their endogenous cannabinoid system, which is responsible for modulating brain signals to the rest of the body. As you can see in the photo, THC and endocannabinoid receptors are very similar in their makeup, which means that the THC takes the place of the receptors and infiltrates the endocannabinoid system. The THC then induces a feeling of dissociation, stress relief, and relief from depressive symptoms as the THC begins flooding the cannabinoid system, replacing those endocannabinoid receptors, and becomes the new brain messengers. We talked about white brain matter a little bit earlier. Research has found that the relationship between lower white matter levels and depressed individuals increases with the use of marijuana. With depression already having reduced white brain matter, by introducing marijuana, you're further hindering your white brain matter levels and contributing to depressive symptoms. This evidence supports the consideration that marijuana has a dose effect on worsened depression and is tied to the development of depressive symptoms in both adolescents and adults. The connection of marijuana to depression is bidirectional, with motivation for substance use driven by symptoms and by symptoms worsening or emerging due to the use of the substance. THC hinders synaptic pruning during adolescence, inhibiting brain functions related to learning and memory. For this reason, it is essential for teens to receive emotional and social support required for healthy development to prevent self medication with consequential substances. In adolescence, parental and guardian awareness and support is paramount in supporting teen needs and preventing delinquent risk taking. Numerous studies using several methods have found that high quality family relationships and increased levels of perceived parental knowledge of teen behaviors are associated with decreased adolescent substance use. That means that when stronger relationships with caring adults and caregivers are present, it increases the positive influences and weakens the impact of negative influences such as peer pressure and substance use. Along with relationship quality, it's also important to look at communication. And a study found that communication that is open and reciprocal with limited judgment is most effective at informing adolescents about and preventing risky behaviors. So it's not just about having that communication there, it's about how we're having that communication. Studies found that adolescents who are depressed in households with lenient and unpredictable rules, who are seeking dopamine, are more likely to engage in negative risk taking behaviors and activities in comparison to those with more regimented households. But we can't just have parents communicating and having awareness and having good relationships if we don't equip them with effective interventions regarding teen depression and substance use. So, by enhancing parent child relationships and equipping parents with effective interventions regarding teen depression and substance use, we would greatly impact the prevalence of adolescent substance use and untreated adolescent depression cases. So, let's go over what we talked about today. Adolescence is a critical time for the development of the brain as synaptic pruning takes place. Sensitivity to dopamine increases adolescent risk taking, and risk taking is not always bad. However, some choices have lasting impacts on brain development. Research shows a strong bidirectional correlation between marijuana use and depressive symptoms. Depressed adolescents may engage in self medicating behaviors with marijuana to curb their depressive symptoms. However, the use of marijuana perpetuates depressive symptoms by decreasing white brain matter, synaptic pruning, and as a result impacts essential cognitive functioning. Marijuana use can have damaging permanent effects on the developing brain, especially when started and used heavily in adolescence. The use of marijuana has a causal relation to the onset of depressive symptoms, increasing the likelihood of substance dependence for relief. Parent-guardian interventions are best received when their relationship with the adolescent is strong and they exhibit effective communication skills. Research finds that preparing adults with evidence-based interventions for depression and substance use disorders would decrease the prevalence of destructive risk-taking behaviors in adolescents. I hope you guys learned something today. This is kind of a niche topic that I feel like a lot of people don't look at because it's just so common for teens to take risks, but it's so important to consider how these risks are impacting their minds. And I hope you guys learned a lot and have a great day.